Good day, everyone. My name is Marian Laris Batalya, and today we are going to talk about Fragile X syndrome. In this lesson, we are going to discuss the definition, the types, the learning characteristics, the educational priorities, the educational placement, and the strategies in teaching. First, let us know what is Fragile X syndrome. Fragile X syndrome is a genetic condition that causes a range of developmental problems, including learning disabilities and cognitive impairment. Usually, males are more severely affected by this disorder than females. Affected individuals usually have delayed development of speech and language by age 2. Most males with Fragile X syndrome have mild to moderate intellectual disability, while one-third of affected females are intellectually disabled. Children with Fragile X syndrome may also have anxiety and hyperactive behavior, such as fidgeting or impulsive actions. They may have attention deficit disorder or ADD, which includes an impaired ability to maintain attention and difficulty focusing on specific tasks. About one-third of individuals with Fragile X syndrome have features of autism spectrum disorder that affect communication and social interaction. When the scientists first discovered the gene that is responsible for Fragile X syndrome, or FXS, they called it the Fragile X Mental Retardation 1, or FMR1 gene. In addition to FXS, there are other Fragile X associated disorders that are caused by the changes in the same FMR1 gene. The FMR1 gene usually makes a protein the scientists called Fragile X Mental Retardation Protein, or FMRP. FMRP is needed for normal brain development. Changes in the gene determine whether someone makes less or none of this protein, depending on how much the gene is changed. Fragile X associated disorders include: first, Fragile X syndrome. Fragile X syndrome, or FXS, is one of the most common causes of inherited intellectual disability. People who have FXS do not make the protein in FMRP. In these people, the FMR1 gene has been turned off. Fragile X syndrome often results from a full mutation of the FMR1 gene. People who have other Fragile X associated disorders, not FXS, have changes in their FMR1 gene but usually make some FMRP. In these people, the FMR1 gene is not turned completely off, but the gene does not function normally. Fragile X associated disorders can be caused by this type of partial change called a premutation of the FMR1 gene. People with a premutation of the FMR1 gene do not have FXS but may have another Fragile X associated disorder. Some people with a premutation may have noticeable symptoms, or others may not. Second, Fragile X associated primary ovarian insufficiency. Fragile X associated primary ovarian insufficiency, or FXPOI, is a condition in which the ovaries are not functioning at full capacity in an FMR1 premutation carrier. Ovaries form a part of a woman's reproductive system. They are like a nest that contains all of a woman's eggs. The eggs are released to the uterus each month midway through a woman's menstrual cycle, where they wait to be fertilized. If not fertilized, they leave the body in the menstrual period. The ovaries in women with FXPOI do not function to full capacity and may resemble ovaries of an older woman, both in the number and quality of available eggs. Women who have premutation in their FMR1 gene are at higher risk for having children who have FXS. Third, Fragile X associated tremor or ataxia syndrome. Fragile X associated tremor or ataxia syndrome or FXTAS is a disorder of the nervous system that can cause tremors and problems with walking, balance, which is also called ataxia, memory, and mood disorders among older adults. FXTAS can be caused by a premutation in the FMR1 gene. Fragile X associated disorders can be passed on by carriers of the FMR1 gene mutation who have no apparent signs of an FXD. In some families, a number of individuals may be affected, while in other families, a diagnosed individual may be the only known family member to exhibit symptoms. Also, in some families, only carriers are identified and there are no apparent affected family members. That is all for my part. Thank you very much for listening. Up next will be the learning characteristics and educational priorities for Fragile X syndrome, which will be discussed by Angel Padilla.
Learning characteristics: speech, fast rate, disordered rhythm, oral and verbal dysprasia, increased volume. Language, relative strengths in receptive and expressive vocabulary, syntactical skills, commensurate with language age, strong verbal and behavioral imitative skills, strong visual skills, and lastly, good sense of humor. Pragmatic difficulties, phrase and topic perseveration, high use of automatic phrases, difficulty with semantic relation, poor abstract reasoning skills, auditory memory sequencing difficulties. A person with Fragile X syndrome often feels overwhelmed by sounds, sights, movements, touch, and even by the smells and tastes in the environment. This sensitivity to stimulation can be very upsetting, and the person may try to stay under control by constant talking, hand flapping, or hand biting, avoidance of eye contact with or withdrawal, rather. Educational priorities. Finding the most effective interventions for students with Fragile X syndrome can be difficult and often results in a trial and error approach. There are certain curricula that are produced commercially for related populations that have been used with students with FXS. These interventions can be cross referenced with educational goals and aligned to learning standards. Individuals with FXS require targeted educational treatment in order to access their abilities. advocating for an appropriate educational program, whether it be in the school system or through the transition to the world or work, requires an understanding of best practice and allows for more success in the process. With supports and curricular adaptations rather, people with FXS will be more able to reach their full potential.
Educational placement. There are three options for the classroom placement of a child with Fragile X syndrome based on the child's specific abilities and needs. First, full inclusion in a regular classroom. This emphasizes to include students with Fragile X syndrome in a general education classrooms. This movement that children with Fragile X syndrome have a considerate interest in people. However, the effectiveness vary from one individual to another. Placement options must include enough flexibility to meet the child's needs. Second, inclusion with pull-out services. Pull-out services where students with Fragile X syndrome goes to the pull-out provider's classroom to work one-on-one or in small group setting. Students get more direct instruction that's tailored to their unique needs and where there are fewer distractions for students, and where students have more personalized interactions with providers which helps students build trust and give them extra support. Third, full-time special education classroom. There are 6 main types of special education settings. First, inclusive classrooms. Second, exclusive classrooms. Third, specialty schools. Fourth, residential programs. Fifth, push-in services. And as mentioned earlier, the pull-out services. These are the teaching strategies for a student with Fragile X syndrome. First, provide a calm and quiet classroom environment. Teach the student to request a break and provide a safe refuge area. Consider distractibility and anxiety issues when arranging setting for the student. Use small group or one-to-one instruction when teaching novel tasks. Infuse a sensory diet. Give ample time for processing and alternative methods of responding. Simplify visually presented materials. Use high and low technological adaptations. Provide the visual schedule and/or transitional object or task. Use manipulatives, visual material paired with auditory input, videos, and models. Provide social skills lessons and social stories and engage typical peers to the model appropriate behaviors. Provide completion or closure for activities and lessons. Capitalize on strengths in modeling, memory, simultaneous and associative learning. Use indirect questioning in a triad format. Utilize close or fill-in techniques for assessments. Use backward chaining. Provide visual cues. Use reinforcement such as high fives. Introduce novel tasks interpairs with familiar tasks. And lastly, avoid forcing eye contact or giving look-at-me prompts. With these teaching strategies, it helps students learn or gain better understanding of their course or field. This allows the students to make the learning experience more fun, practical, and can also encourage students to take more or an active role in their education. Thank you.